So, that video really focused on a study that came out about a year and a half ago, trying to pinpoint what we know to be true, that the climate crisis is an extraordinarily dangerous problem when it comes to public health, and also a hugely expensive one. Over the years, we've heard a lot of discussion about the sacrifices and the investments that we'll need to make to transition our world to the cleaner, healthier energy future that we all know we need. Unfortunately, our side of that debate, our understanding of the very real harms triggered by climate change, has been ill-equipped to speak to the health-related economic burden of hospitalizations, emergency room visits, and early deaths, all associated with climate-sensitive events. We know this to be true, that the climate crisis is here and now, and these impacts are widespread. There's really no corner of this country that is being spared from the terrible health implications of worsening climate change. Hit the next slide, Colin. So that's why we're really thrilled to launch this brand new report alongside the Medical Society Consortium on Climate and Health and Wisconsin Health Professionals for Climate Action. The URL is at the bottom of this slide, but it's also on the resources page for the conference itself. This report takes a leap forward beyond that study that the video focused on to zoom out, not just on a set of case study events across the United States, but really tries to, show how much climate change is costing the entire country each year. And we're also not just talking about climate change here, we're also talking about the burden of fossil fuel generated air pollution. I'm a former EPA scientist, and unfortunately, what we've seen in recent years is that our air pollution problem threatens to get even worse due to climate change. We know that fossil fuels trigger deadly microscopic soot air pollution, PM 2.5, but it's also worsening concentrations of ground level ozone. The American Lung Association's State of the Air report confirms that more than 130 million Americans, more than 1 in 3 people in this country, are living in areas that exceed health-based standards for air pollution. So we know that we've got a costly problem on our hands, and this report is really the next step in equipping all of you, health professionals on the front lines of treating people in emergency rooms and hospitals and other settings, with the numbers to inform your advocacy and demands for action on both mitigation of climate pollution and stronger investments in climate change preparedness. So Colin, if you can click on the next slide, actually click twice, I think, you'll see the range of climate sensitive outcomes that we explored in our report. We synthesized the latest peer-reviewed public health science, looking at all of this wide range of climate sensitive events. Each of the problems depicted on this slide is expected to worsen in frequency, intensity, duration, and or geographic extent into the future if we fail to step up, cut climate pollution, and reduce the health impacts associated with exposures. We know, as the video shared, that our most vulnerable neighbors, Medicare and Medicaid patients, right now are shouldering a disproportionate burden of illness-related costs. And now is the moment to talk about those costs in dollars and cents. Colin, if you can click once more. The big take-home number from our report is $820 billion. That's our estimate of the annual price tag of fossil fuel generated air pollution and climate events across the country. It's an annual estimate, and it's very likely a conservative one. Because of limitations in our public health surveillance systems, we really lack the ability to articulate the full range of climate-related health harms and the costs associated with treatment. But what we know now is certainly plenty of motivation to act on this problem. If you can hit the next slide, Colin. Our report walks through all of the range of health costs associated with climate-sensitive events. So we're not just talking about the expense associated with treating people in emergency rooms and hospitals or the economic impact of early deaths, but also all of the costs that are spotlighted in that video, right? All of the ongoing needs for care and treatment and recovery to deal with really profound and sometimes irreversible damage to human health. We know that right now, more than half of American adults report medical financial hardship. That means they are delaying or completely foregoing necessary medical care because they can't afford it. So this report is really shining a spotlight on this whole range of costs that we can reduce through smart climate action. The next slide here depicts some of our recommendations that are spelled out in a lot more detail in the report. You can just click through them, Colin. Yeah, so we're talking, of course, about motivation to aggressively cut climate pollution and step up our efforts on adaptation. This can't be an either or scenario with mitigation sort of in contest against adaptation. We need both. But we also need all of you, health professionals who are on the front lines dealing with patients with these problems, to push for climate action within your professional roles as experts here, decarbonizing the healthcare sector, promoting health care systems that are resilient to climate risks and that can keep the power on during extreme storms and wildfires, for example. And also, of course, broader integration of climate change and health-related costs into training in medicine and public health. So with that, I will wrap up. I'm going to leave my contact information here on the slide. I just want to say, we have the information based on 50 years of the Clean Air Act to know that investments in reduction of pollution pay off in huge dividends. EPA estimates that the benefits to costs of the Clean Air Act are about $2 trillion of health benefits, outweighing the implementation cost by a factor of more than 30 to 1. And then on the next slide, I think the argument here is that the same is going to be true of climate change. Aggressive cuts to deal with the climate pollution right now and to bolster resilience will pay off hugely in annual returns to public health and reduced healthcare spending. So with that, I'll wrap up and leave my contact information on the slide. We look forward to your feedback and use of the report. Hopefully it's of use for your Hill visits on Tuesday, in making the case that in many ways, we are right now paying immensely to deal with inaction and delay on the climate crisis. Thank you.